Hi Medicos, we see the carotid triangle of neck with the dissection, which is an important triangle of the neck. Carotid triangle. We'll learn about the boundaries, roof, floor, and contents of the carotid triangle. So, first we'll start with the boundaries. Superiorly, there is posterior belly of digastric muscle. Anterior-inferiorly, we see the superior belly of omohyoid. Posteriorly, we see the anterior border of sternocleidomastoid. Here in this diagram, we'll see the superior border, which is posterior belly of digastric muscle, and the anterior-inferior border, which is formed by superior belly of omohyoid muscle, and the posterior border, which is formed by anterior border of the sternocleidomastoid muscle. Okay, these are the boundaries. Then we'll see the roof. Roof is formed by first skin and the superficial fascia, which contains platysma muscle, cervical branch of facial nerve, and transverse cervical nerve. Okay, and the investing layer, which is a part of deep cervical fascia. Okay, then we'll see the floor. Floor has four muscles. They are thyroid muscle, hypoglossal muscle, middle constrictor, and inferior constrictor muscles of pharynx. Okay, so here we can see the thyroid muscle, which is in between the hyoid bone and the thyroid. So this is thyroid muscle, and this is inferior constrictor muscle of pharynx. Okay, inferior constrictor of pharynx, and this is middle constrictor of pharynx towards the sternocleidomastoid, and this is hyoglossus muscle. Okay, these are the muscles of floor. Then we'll come to the contents. Contents, here we see the carotid arteries. There are three carotid arteries: common carotid, internal and external carotid artery, common carotid artery, internal carotid, and external carotid artery. External carotid artery has five branches. They are ascending pharyngeal artery, superior thyroid artery, lingual artery, facial artery, and occipital artery. So we'll see in this diagram, this is common carotid artery, which is dividing into external carotid and internal carotid artery. External carotid artery with five branches. They are superior thyroid artery, lingual artery, then facial artery, occipital artery, and ascending pharyngeal artery. So these are the arteries. Then we can see the carotid sinus and carotid body, then internal jugular vein, and there are three cranial nerves: 10, 11, and 12 cranial nerves: vagus, spinal accessory, and hypoglossal nerve. And we can see the ansa cervicalis, then cervical part of the sympathetic chain, carotid sheath, and deep cervical lymph nodes. Here we can see the internal jugular vein. Okay, and the nerves, coming to the nerves, here we can see the hypoglossal nerve, which is a 12th cranial nerve, and the vagus nerve, which is coming down, supplies the internal organs, and this is the spinal accessory nerve, which is 11th cranial nerve. Okay, and this is ansa cervicalis, which is coming from the hypoglossal nerve. Okay, and next is deep cervical lymph node near the internal jugular vein, and carotid body, carotid sinus. Carotid body with chemoreceptor, carotid sinus is with baroreceptor. They are present in the junction of external and internal carotid arteries, and sinus is a bulge in the junction. Then coming to the dissection, this is skin, outer covering, skin. Then this is the superficial fascia, which contains platysma muscle. This is platysma muscle, which now we are taking out. So this is platysma muscle. And next, this is the investing layer of the deep cervical fascia. Then now we are taking off its venous drainage and all. So now we'll see the boundaries. This is anteroinferiorly, we see the superior belly of omohyoid, and sternocleidomastoid posteriorly. Superiorly, we see the posterior belly of digastric muscle. Now we see the hypoglossal nerve behind the digastric muscle and giving a small branch to the muscles over there. And now we'll see the carotid contents. So here, so after removing the carotid sheath, now we see some of the contents clearly. So this is ansa cervicalis. This is ansa cervicalis coming from the hypoglossal nerve. See, now we can see that this is coming from the hypoglossal nerve. So this is common carotid artery, then internal jugular vein and the vagus nerve. So common carotid artery is dividing into external carotid artery and internal carotid artery. We can see the inner side is external carotid artery and the outer side is internal carotid artery. Okay, external and internal carotid artery. Now, so five branches of external carotid artery. First one, superior thyroid artery, and second one is lingual artery, which are deep inside lingual artery, then facial artery, occipital artery, then ascending pharyngeal artery. These are the five branches of external carotid artery, which are deep inside from the external carotid artery. And then now we can see the cervical part of sympathetic chain. So these are the contents of the carotid triangle, which are very important contents with carotid arteries and internal jugular vein. Thanks for watching. Like, share and subscribe to my channel for more medical updates.